I've been doing less clinical time, lately, just because of my other responsibilities. So, I've probably done 6 or 7 visits, but I do them at whatever time that my patients might need it. I'd only been doing about a day a week still of clinical care. Because I like still having patients to see because it's nice. And so, but yeah, but I've been doing them whenever they need me. Some of them have um, they can text me, and they ask me if if they need something from me, then I'll just set up shop and go do a visit. I saw someone last night. I did a visit right before I left my administrative office where it was a back pain related issue in a patient who had back surgery in the past, and she's having some other symptoms. I've done a visit for presumptive early diverticulitis, as well as just some follow-up visits for a number of different types of issues, behavioral health related stuff or whatnot. So it's a pretty flexible platform. You can do a lot, and when you can see somebody, it tells you a lot more than if you're just hearing what they're saying. I think there's a lot of opportunity for it. It also depends on what happens with regards to some of the rules around it that have been relaxed during the pandemic. But assuming that there's some return to normalcy, I think we're already using a platform that is HIPAA compliant as it is already, versus using other unsecured media options. So I think that we moved in the right direction for it. I think that, and we had looked at this, even prior to this, how we could apply telemedicine beyond just acute care uses. There's a lot of times to have somebody come in to do a med check or just to check on how they're feeling or how they're doing, since we've been doing whatever the care plan is, that's a lot for a patient to have to do. And it's also very timely for us to do that visit because most of it's going to be, just documenting the visit actually versus the visit itself. So I think that there's lots of opportunities post, COVID, where we can really more smoothly integrate that into. A lot of our behavioral health providers in our health system have been at least 100%, compared to prior, if not exceeding that, in terms of, in the telemedicine environment. So they've adapted very quickly to it, and it adds a lot of value, especially if you're doing it, as a video option, because having that connectivity, there's what you say, but then most of human communication, is based on body language, inflection, all this other stuff, and visual cues versus just auditory. So I think that adds a dimension to things, which is high value from that standpoint. I think that on given current situations and also given like the type of stay in place, kind of isolation is social distancing. I think that when you can talk to them that and see them, that I haven't had anybody hasn't been appreciative of the opportunity. Essentially, you're listening, and it's a far more intimate reaction when you interaction when you don't have all the distractions in the background. They're not sitting in a waiting room. It's much purer in that respect. So I think it's. I've only received positive feedback, and I think from what I've heard, even when we're outreaching to people to see whether or not that are high risk patients, et cetera, and we're just checking in on them, or asking if they want to do a telemedicine visit, even if they decline it, they're just generally very appreciative of the outreach work. I would think so, that, again, the more stuff that we can keep in the community, and keep people in place, the slower the more of an impact we can make on disease transmission. So I think that, wherever we can meet patient need, I think we'll have a significant impact. Again, the surge is surge, so whatever is going to happen, is going to be, people are going to be really sick. They're going to be in the hospital, et cetera. But for everyone else, like, we still have to meet patient need. People had needs before, and, those needs still need to be met. So, essentially this is our mechanism for being able to do that. Or if we need to steer somebody to a direct care site, we can at least know what's going on, what they look like, if they have a temp, things like that. And then we can make sure we're steering them to the right location for care. So if they need an ER visit, they need an ER visit. If they can be managed at one of our urgent care sites, then so be it. Or if they're well, or if they're sick, we have locations of care for them. So we can actually triage them to the appropriate location of care more effectively than if we were doing it just by audio only. I mean, I would say that every one televisit that we do, potentially saves a life. So the work they are involved in doing, if you're a PSR, if you're a nurse, or anybody else that is helping to um, um, outreach to those patients in need, or to try to accommodate the ones that are calling us, makes a significant difference. Telemedicine it's a great modality, and the value add of being able to see in addition to hear is important, and we can provide a needed and high value service for that, and that they're all critical components of making that happen. So I would encourage everyone who's been involved in that process, to continue to think outside the box and to look for opportunities. And again, our whole health system originally has been built around waiting for people to call us when things are bad. But that, this is a wonderful population health opportunity for us to actually reach out and utilize our considerable resources now to reach out to patients and check on and why they're well, or to keep them that way, especially amongst the highest risk and the neediest populations that we have that are on the fringe already, because we need to keep them out of the hospital. Otherwise, they become part of what's going to happen in the surge.